My name is Susan Gaines. This is my presentation for Social and Cultural Diversity. I will be discussing the mental health barriers and therapeutic needs of the LGBTQ plus youth living in rural southern communities. Research highlights the unique challenges the LGBTQ youth face in rural areas, especially the South. These young people often deal with isolation, stigma, and very few affirming resources. I will cover the mental health concerns and counseling strategies that can make a difference. The goal is to identify how counselors can respond effectively and ethically to these needs. Mental health is essential for everyone, but for LGBTQ plus youth in the rural South experience added risks. Many live in conservative areas where support is minimal and stigma is high. This makes them more vulnerable to depression, anxiety, and suicide. My purpose is to explore these challenges and offer evidence-based counseling resources. Research shows higher rates of mental health issues among the LGBTQ plus rural youth than their urban or straight peers. These youth often can't access affirming care, which worsens their sense of isolation. Many fear discrimination if they're seen seeking therapy, and this population is often overlooked, and counseling as a whole must respond in a more inclusive way. I reviewed studies from the past 5 years. My focus was on research that examined both mental health outcome and interventions. While some studies looked broadly at LGBTQ plus youth, I prioritized those with rural Southern relevance. These findings shaped the direction of my counseling recommendations. LGBTQ plus youth in rural areas face significant mental health challenges. Elliott and his colleagues found higher rates of depression and anxiety in this population. Feelings of isolation, invisibility, and community stigma also contribute to these poor outcomes. Youth are often afraid to seek help because they don't want to be judged. Access to affirming care is extremely limited in rural areas. Many providers lack cultural competency, which makes youth feel unsafe or misunderstood. Holt and others found that some youth will skip care altogether because they can't find a supportive provider. In smaller towns, there's also the fear of being outed simply because you've gone to a therapist's office. Peer support and connection can play a huge role in mental health outcomes. Schools with gay-straight alliance clubs and trained counselors improve student well-being. Family acceptance is one of the strongest predictors of reduced depression and suicide risk, and this means interventions must reach beyond just the therapist office walls. Teletherapy is one of those recommendations that can help remove barriers for some of these youth. It provides privacy and allows access to specialists across the state or region, and this is especially helpful when local therapists aren't trained or affirming. Research by YBay and others support its effectiveness, particularly for this group and their mental health needs. One major issue in the research is the lack of subgroup-specific data within the LGBTQ plus populations. Most of these studies use self-report surveys, and they can be biased or limited in depth. There's not enough research focused solely on the rural South. We need future studies that address intersectionality and the unique overlap of identities in these communities. Counselors should pursue training in LGBTQ plus affirming therapy practices. We need to create a warm, welcoming space that's essential to building trust. Telehealth can be a valuable option in these, situations. Cultural competence needs to go beyond awareness, and it has to be built into treatment planning. Counselors should partner with schools and local programs to improve visibility and support. Educating families on LGBTQ plus acceptance can improve their mental health outcomes. Advocacy at the policy level can change the systems that block access to care. And outreach, again, has to extend beyond the therapy office to make a real community impact. For recommendations, we need to partner with schools and educators to build inclusive programs. We need to provide family education workshops to reduce stigma and promote understanding. We need to push for inclusive policies on school boards and in healthcare settings, and we need to build relationships with other affirming providers and organizations in the region. To wrap up, LGBTQ plus youth in rural southern communities face major mental health and access barriers. With appropriate interventions like telehealth, family involvement, and advocacy, we can improve their outcomes. Counselors have a key role to play, not just in therapy, but in changing the systems around these youth. Every action we take towards cultural competence and inclusion will make a difference in their lives. Thank you.